Good afternoon to our viewers on the Northern Mariana Islands. Thank you for joining us. Today we're grateful to be joined by Dr. Norma Ada with the Medical Associates of the Pacific. Dr. Ada, thank you for joining us. How are you doing?
I'm doing great, Thomas. How are you?
Great, doing well as well. I wanted to go ahead and jump right in. I know it's been a busy month for you. Wanted to first talk about today. We know that the news about the drive-through testing in the CNMI was just launched. What do you make of the current response to COVID-19 in the Northern Marianas?
I think it's actually great news for our island communities. Ever since the warning came out, because of our proximity to China and the frequent flights coming in, all of us medical personnel, we were very concerned. And I know since at least late January, early February, especially when the governor convened that task force. So we've been preparing, but our preparedness was really hampered. We were flying blind without the capability of doing local testing. So last week was the first time we were able to do on-island testing, and that was a welcome relief, especially in situations where we needed to know the answer within 24 hours, sometimes within hours versus waiting, shipping it over to Guam. But I know that it was impossible for us to do our own COVID-19 diagnosis when the criteria was so super strict. Back in early February, where we had to send specimens to Atlanta and via Hawaii. I mean, that was just not doable. It wasn't also practical for us, and we were especially worried because we were receiving a lot of tourists from China throughout that time period until, of course, the travel ban.
Right, and so we know that social distancing is now becoming the norm. What suggestions do you have for folks living in, multi-generational households, both in the NMI and for our Guam viewers as well, as they go through their daily lives as this becomes the new normal?
Well, you can't really compare us to what's going on in the rest of the world, especially like New York, where you have population dense areas. So the incidence of the actual infection is high. Here, we know that the cases of COVID-19 came from outside. So now that we have local testing capacity, it gives us the ability to, if someone had symptoms or came from outside of the CNMI, we can, do the investigation, contact, isolate, and trace. So there's a bit of breathing room. However, you have to understand that our island community, both in Guam and Saipan and also the rest of Micronesia, we have a huge high chronic disease burden, not only in the Manomku, but in our 30, 40, 50-year-olds. So we have a at-risk population that will get sick if we get infected. But practically speaking, first of all, with the super typhoons, it really cut down the available housing. So it's not like we can all go live somewhere else. We sort of have to adapt. We have to designate someone to be the one to do all the shopping. And then for our elderly parents and grandparents who live with us, we sort of have to tell the kids, look, grandma and grandpa is staying with us, or uncle or auntie who's on dialysis or who's just recovering from a heart operation or from cancer treatment. You want to sort of have them be separated from the rest of the family members who are still working or have essential jobs, working in grocery stores or working at phone companies or working in various government offices or private businesses. But it's not super practical, but I think each family just has to be cognizant of that. But also the young generation, because, we have restless teenagers who are not in school, especially if they're public school students, they're restless. They're going to still hang out with their friends. And I think the parents and the grandparents just shake their head, but everyone, I guess, tries their best. And as long as people wash their hands, and as soon as someone starts to feel ill, like runny nose or body aches, now that we have local testing capacity, please take advantage of that and go to the tent at CHC.
Dr. Ada, I wanted to follow up with that answer then. Now we know that this request for a test is now available. You can schedule that appointment through drive-through. Is there any right time to get tested? We know that the governor's office said, it doesn't improve your response if you get tested. It doesn't reduce your chances of transmission to get tested. So, what's your thought on that?
I think the fact that they're making the community-wide testing available now is you look at the goal of the testing. The number one goal is obviously to identify who may have symptoms, especially if they came for that cluster, the faith-based organization. From people, we have a lot of contract workers or contract workers and their families staying in single room dwellings with common kitchens. And then you still have healthcare workers, you still have home visiting nurses, you still have dentist offices. Those are the ones that really should, especially if they've been exposed in the past under 4 weeks. The tests have limitations because depending on the nasal swab, if you were exposed or you think you were sick more than a month ago, it's not really useful. However, from from a statistical standpoint in epidemiology, asymptomatic carriers, that's an advantage to having community-based wide testing. But perhaps that's more useful where the incidence of the disease is really high, like in New York or in California and Florida. But in Saipan, when you only have, I think we had 15 positives, maybe there's still a usefulness to testing to see if we have asymptomatic carriers. But the best advantage right now is that we can test if we think we have symptoms or we've been exposed to someone in the past 4 weeks, because the test that is being done community-wide is it's the PCR test, it's the nasal swab, and that will stay positive at best 28 days. And especially the first to 14 days, it's useful, but you're going to start seeing what we call true negatives and true positives the longer you haven't been exposed to potentially an ill person, or the longer you waited to be tested past at least 28 days.
Right. I think the last time we saw was 14 positives, 2 deaths, and 11 recoveries. I wanted to shift now to something that the clinic posted online. You talk about collateral health consequences of disasters. You say if it's one thing our community has learned from the past, it's of these two super typhoons, it's that these consequences of disasters can pose greater harm than the disaster itself. And so I want to ask you, how much more important does primary care become then amid this pandemic?
It's very important because I've alluded before, we have a high chronic disease burden with our diabetics, our heart disease. We have a disproportionate number of people on dialysis per capita, but also our cancer patients. We have young cancer patients because of our betel nut smoking. I have a handful of patients with new diagnoses of cancer that they're sort of in a holding pattern because they can't go to KUAM for more testing, like an MRI is needed, or the specialist that can actually perform the biopsy is on KUAM and it just can't be done on Saipan. So we have to be more extra vigilant so that people don't fall through the cracks. And then we still have to make sure, and it's well known throughout the world, that heart disease and diabetics tend to the mortality rate for if they actually get infected with COVID-19 is quite high. So we still have to manage our heart failure patients and our diabetic patients. We have to tell people, please, you're overdue for your blood test. CHC and the local place that does it's called diagnostic lab, where people can actually get their blood drawn. We have to reassure our patients that both of these healthcare facilities are practicing social distancing. So it's not like before the COVID-19 where there's 20 people in the waiting room. Healthcare facilities are reassuring patients, please come and get your blood test done. Please come see specialists. Please, the specialist that you were supposed to see before the pandemic, see that specialist on site. You need to still manage these chronic diseases. And the same thing for pediatrics. We need to make sure that we're not lax when making sure that our children are still on top of their vaccinations, because we don't want to see cases of meningitis because they didn't get their bacterial, what we call these disease preventable bacterial infections. And it's very important for children to be on time with pertussis, with meningitis and pneumonia preventing vaccines, with the hepatitis vaccines. So those are all those things that we still have to stay on top of to prevent what I call the secondary consequences if we keep postponing or delaying because of fear, or fear of the facility being a harbinger of infection, which is not true. And so we Dr. Hofschneider and I keep reassuring our patients, please don't be afraid to get that CAT scan because we found something in your tummy or in your lung or in your neck. And don't forget to get that long overdue ultrasound because of you've been having these kind of symptoms.
And speaking of those secondary consequences that you just spoke about, what is your opinion then on reopening the island and community? As a doctor, what might be your view on approaching recovery for the NMI?
I'm not a policymaker. I'm a primary care physician, so I'm going to defer that to the policymakers. From a physician standpoint, I think that now we are able to do local testing. That is the most important thing in terms of factoring in when is it to slowly maybe remove these restrictions. But you also have, these are really precious resources that we have, this local testing capacity. I have physician friends in Texas where they can't possibly test the millions of residents in their cities. So we are really fortunate enough that we at least have thousands of tests available. So we want to do smart testing so that these precious resources, the local testing capacity, is sustainable. So whatever testing theory we have, is this still a viable testing in July, in August, in September when the flu season starts? I'm not really sure about when schools are opening because this virus is not going away. This is a marathon. This is not a sprint. So the testing capacity has to be sustainable until there's vaccine development. That's when the entire world will have a sigh of relief when we hear on a daily basis vaccine breakthroughs. I mean, different countries are racing for vaccine development, and that is our best hope right now. But the testing capacity has to be sustainable because this virus is not going to go away. We're not going to return to the old normal or new normal. We really don't even know what's the new normal. We have to know about what our capacity is locally because of our geographical isolation, but also we're hurting economically because of tourism. That's the backbone of our economy right now, and it's terrible.
And Dr. Ada, just to wrap up our conversation, do you want to share any words of encouragement or reassurance during this public health emergency with our viewers?
I think to think resiliency and what I just said a minute ago is this is going to be a marathon. This is going to be with us. This is really just going to change the world as we know it because of the unknown about this virus. I mean, it just popped into our day-to-day vocabulary really in February, so walking 3 to 4 months ago. So resiliency, resetting priorities, especially the most precious to us, and that is the ones next to us and our family and our loved ones and our workmates, and how to make a sustainable, how to adapt our economy now. What do we do with travel? Because we're just such a travel-related industry. What do we do with food? I mean, are we now going back to identifying areas around our island community to sustain food production? So resiliency, and I think what has taught us, the older generation know a lot about resiliency after the war. The new generation, well, not so much the new generation, but the working class generation with the past 2 super typhoons of how much can be destroyed in one day. And this is kind of destroying lives weeks after weeks as long as we have no travel. So how to be resilient in this phase, in this time of crisis, and we have to adapt to this life-changing series of events. And as they say in Chamorro, nai onamo, na mesmo nanzo, right? Just be strong, hang in there.
All right, thank you so much, Norma Ada, with the Medical Associates of the Pacific. We thank you for all the work you're doing there on the front line of the clinic and the office. And at a time where many people are telling us to turn to the experts, we're grateful for your time and providing some guidance and advice to our viewers in the NMI and Guam. Thank you again, and thank you to our viewers for joining us. My name is Tomas Manglona, reporting here in Saipan.
Thank you.